Angles. I want two angles on it.
Alright, so I'm going to start with the vessels. Okay? So I'll start with the veins. The veins are symmetrical. This right here, this big, large vein here, is the superior vena cava. Down here, it's hard to see, but this is the inferior vena cava. Okay? So from the superior vena cava, you have it's cut here, but the superior vena cava moves up and it splits, it bifurcates here, and you have the brachiocephalic vein. Okay? And then it's again cut kind of on that side, but if you look at this side, this is your external jugular, your left external jugular vein. Okay, it goes up towards the head. And then your left subclavian vein. Okay? And with the veins, it's the same on both sides. Except obviously on this side, it's the right subclavian and the right external jugular. Okay? If you flip this up, you'll see the arteries. So the aorta is kind of tucked in right here, so it's hard to see. But then you have the first branch off, which is your brachiocephalic artery. There's only one brachiocephalic artery. Remember, there were two brachiocephalic veins. Brachiocephalic artery then goes to the right subclavian artery, right common carotid artery. Okay, so this is the arterial equivalent of the external jugular. Right? So this is the right common carotid. Here, left common carotid. Okay, and then way back down here, because it branches off the aorta, is the left subclavian artery. Okay, that's this one right here. So you can count 1, 2, 3, 4.
Is that last one hidden, or
It's
will that go
right there, yeah. Okay? You're gonna have to kind of just find that one. It's gonna be right beside the big brachiocephalic artery. Okay? In humans, this branches off down there. The left common carotid. Yeah, there's 3 branches off there. Okay? But you guys just need to know how to identify that on the cat. Okay? So obviously if the veins are pushed away from that and I have a pin in there, I'm talking about the arteries, I'm not talking about the veins. Okay? Now on to the organs and such. I'll just do one right up here. This is the trachea here. Okay? Alright, so that leads right to your lungs, which you can kind of see there.
The trachea is right behind the veins, or the arteries right there?
Yeah.
Okay.
Right? You can see the ribs of the cartilage. Okay? Then if you look down here, you have this flap here that separates kind of the lungs, the pleural cavity, from the rest, and this is the diaphragm. Okay? So see how it's muscle, so it's got these striations. Okay? And then the big, large thing you have on the right side, this is the liver. It's got multiple lobes. Okay? Beside it, the big flappy sac. This is your stomach. Okay? If you follow the stomach down, right around here is where it ends, and it goes into the small intestine. The first part of the small intestine is called the duodenum, or duodenum, some people call it. And then you can follow the small intestine, which everyone should know is this really convoluted area. And then it will thicken out on its distal end as it becomes the large intestine, okay? And you can see it goes all the way down to the colon, okay?
Okay.
Jejunum?
Pardon?
Jejunum? We don't need to know that.
No. No. Jejunum is part of the small intestine. Okay.
We don't need to know the colon, right? So.
No. That's just so that you guys know. Okay? Yeah, and then this is the mesentery, this stuff that kind of suspends and holds the small intestine. Okay, this really thin stuff,
Yeah.
mesentery. This greasy stuff here is the greater omentum. Okay, it usually covers, it's kind of just everywhere. If you look back here, right on the back posterior wall, a really small, hard.
Is that kidney?
Yeah, that's a kidney. Okay. On the upper cats, it'll look blue.
Can you stop like bumping into me when I'm trying to record this?
Okay.
Okay, there you go. Better?
Okay, that's the
Someone
kidney.
has attitude in this class.
Okay. So, coming down from the kidney will be the ureter, which you can't really see here, and which is also why I've crossed it off. Okay.
That makes sense.
But it will then insert onto the urinary bladder. Okay?
That little ball right there?
Yeah. And my best guess is this is the spleen. Okay, spleen's going to be on the left side.
The brown thing?
Yeah, the brown thing here.
That's not on it.
No, I'm not going to test you on it because I'm not 100% sure. And then the pancreas is usually,
You said that the big greasy one is what again?
Greater omentum.
yeah.
Okay.
So the pancreas is usually somewhere underneath. But this is being pulled out and fallen apart so many times. Maybe this was over there. So it's hard to tell. Okay?
Sounds good.
But you guys are, small intestines are easy. Right. Duodenum is a little difficult, but the only thing you need to tell the difference between is just if you find the stomach right at it's the first part. Okay? So if I pin this, it's going to be, within an inch of the stomach. Okay?
Yeah.
That's it.
Okay.